Okay, there we go. Hi, everyone. This is the first time I've done a presentation in this format. So figuring out the technology is part of the equation. As people's faces were popping up, I saw some familiar faces. So hi to those of you that I know, and hi to the rest of you. Thank you for coming on a beautiful Friday. This has been wonderful as far as melting some snow. For those of you who are cross-country skiers or downhill skiers, hopefully you still have nooks and crannies where you can do some of that and continue to enjoy it. But I've been enjoying the warm weather. So today we are going to talk about clinical supervision, some foundational pieces around what clinical supervision is, some considerations, some training considerations, and talk a little bit about when you are presented with ethical dilemmas, when you're a supervisor, how do you go about working through those and trying to figure out what next steps might be. And that's what our breakout sessions will be about, is here are some scenarios, how would you handle that? And then we'll kind of be able to discuss that. So let's see here. All right. This doesn't want to move forward. There we go. So the objectives that we're hoping that you all will have is an understanding of how to implement supervisional guidelines for your own professions. There's been some assumption on my part that we would have some combination of psychologists, counselors, and social workers. And each profession does have some different guidelines, although there's a lot of overlap and a lot of similarity between them about supervision, what it is, how you do it, et cetera. And the ethical guidelines too are slightly different between the professions, but a lot of similarity and a lot of overlap. And we'll talk a little bit about that. And utilize ethical decision-making models to resolve supervision-related ethical challenges. And that will be presented, and that will be part of what our breakout session will be. And identify resources and information for future education and training and supervision. And that will also be something that we talk about. So those are the objectives that I'm hoping that you will come away with. And for today's schedule, like I said, I'll do an overview of clinical supervision, some ethical considerations. We'll have the breakout discussion and we'll do Q&A. And as Julie indicated, if you have questions along the way, you know, just type those out. She will let me know and we'll be able to kind of try to answer your questions as we go along. So to start with, there's a definition that Bernard and Goodyear have written a book on clinical supervision that's been used in so many different classes. It's kind of universally accepted in a lot of places, especially in psychology and counseling, because the authors, one's a counselor, one's a psychologist. So basically, I'll go ahead and read it. Supervision is an intervention provided by a more senior member of a profession to a more junior member or members of that same profession. This relationship is evaluative and hierarchical, extends over time, and has the simultaneous purposes of enhancing the professional function of the more junior person or persons, monitoring the quality of professional services offered to the clients that he, she, or they see, and serving as a gatekeeper for those who are to enter the particular profession. So the interesting thing about this definition is that psychology, for example, has used this definition to build some of their clinical supervision guidelines around. So to break down the definition a little bit, is an aspect of clinical supervision that's important to understand is that it is a discrete intervention of its own. I know that when I was becoming a psychologist over 20 years ago, clinical supervision, there was a bit of a mindset that as long as you're a good clinician, you should be a good supervisor, that you have the skills on board to be able to do that. And I think over time, well, I know over time that there's the recognition that supervision is a discrete intervention of its own, that has its own skill set, has its own models, has its own growing research behind it. So the definition allows for the definition, the understanding that clinical supervision is an intervention. And also the other piece is that, appropriate training. And many of the professions have understood that they're more understanding over time that you need to have the training, appropriate training for it. Psychologists, for example, in their graduate training, it's become an American Psychological Association requirement that clinical supervision be a class in the curriculum. So in counseling, many programs offer supervision, and at the doctoral level, it is a class that's important. So there's been more of an understanding that getting training and grounded in supervision is something that's important. And even throughout my professional career, it's been interesting to see how more importance has been lent into supervision, clinical supervision needing to be identified as an intervention all by itself. So I'm not going to go into a whole lot of detail about the models of supervision. There are a lot out there. There are a growing number of books out there for people to take a look at. Even through your professional organizations, there will, and I've taken a look, there are books that are offered through your organizations, through counseling, psychology, and even social work. So take a look at those. But generally speaking, supervision models fall into three different categories. One category is if you are drawn to a particular theory and application, then you certainly can build your supervision around whatever your theory is. So there are supervision models that utilize the theory and allow you to apply clinical supervision through whatever theory or theories that you ascribe to. And some of the considerations around that is being able to explain to your supervisee what your supervision model is, what they're going to be experiencing from you around your supervision, and what they can expect, and being able to understand and that it has a grounding within a theoretical model. And that can be important for your supervisee to understand, because if that's not the model that they're working from, that's going to be something they're going to be learning from you throughout your experiences with each other. Developmental, and I'm going to speak a little bit more about developmental in a minute, but the developmental models take into consideration that your supervisees are going to be at different developmental places when you're working with them. If you happen to be working in an academic setting, you are probably going to have what I call newbies, where you're going to be working probably with people in their first practicum, people who are very new to applying what they've learned from classes to clinical experiences, and their developmental process or experience or placement in that developmental category is going to be very different than if you're supervising somebody who is at their ending internship or doing a postdoctorate. So you as a supervisor being able to understand what that means at each place can be really important. Then there's the social role integration. So it's basically what are aspects of conceptual ideas that we can combine together to work with supervision. An example of a social role integration model is something called the discrimination model, where as a supervisor, you are basically wearing different hats as, as a teacher, as a consultant, as a counselor. Not that you're counseling your supervisees, because that would be unethical, but what is it that they're maybe getting stuck with around working with their clients that they could better understand to work better as a clinician and as their professional growth. So being able to keep those in mind as a supervisor can be an example of the social role integration kinds of models. And I want to talk about the models. The reason I wanted to even present the models is because ethically, we are understanding more and more that you need to have a foundational understanding of where you're coming from as a supervisor. Just like as a clinician, you have the theories that you're ascribing to, that you're building your clinical practice upon. You also want to have model from supervision that you're working from. I remember going to a presentation for supervision and the presenter saying, if you ever get brought before the board of your licensing board around supervision, you want to be able to speak to the model that you're working from. Here's the model. I work from a theoretical orientation, and this is how I present it to my supervisee. My supervisee understands it. Here's the framework. You want to be able to explain all of that and not say, well, I just basically tell them what to do. I really don't have a model that I work from. So this is a consideration ethically that you're working from a model of supervision. So that's why I wanted to cover it. And not everyone gets a grounding in supervision. As you can probably tell, I'm a big fan of supervision. I'm a big fan of people getting trained in it, because the more you learn about what the models are, how to work within them, the more you realize, oh, this gives me a whole nother foundation to work from and a better understanding of how to be a supervisor. And I found that it even makes me a better clinician. So I did want to talk about the models because I think it's really important to have that pretty clear, that having a model is important. I do want to talk a little bit more about the developmental models. I think for many people who have been trained in supervision, they often will have the developmental model as is kind of a foundational piece, as many of us clinicians may have Rogers as a foundational piece of building relationship rapport, those core conditions. I think many people who do supervision have that developmental understanding when especially if they're working with a lot of supervisees who are at different developmental levels. That understanding that different levels need different efforts from you as a supervisor and in their professional development. One that's very popular is the Integrated Developmental Model, or the IDM. And I'm just going to very briefly talk about it. There's more details about the IDM and about the discrimination models in the longer booklet that I printed or that was sent to you. You may not have printed it out. And I provided that to you so you could have additional information. Your booklet does go into those two models particularly, because they're the ones that I tend to use and I find them helpful, and they're user-friendly. So I wanted to, at least for those of you who may not have had a whole lot of training and supervision, wanted to give you some additional information about at least those two models to give you a little bit of grounding. So for the IDM, very much like I have been talking about, that you may be working with someone who's in their very first practicum, you may be working with somebody who's a postdoctoral. And level one with the naive awareness, think about when you were going through your training in your first practicum. It's like, okay, I've got all this knowledge, now I'm applying it. I have no idea what I'm doing. And it's really scary. So having a supervisor who understands that and can provide the support and being able to really provide the scaffolding that you need at that level can be so important. So no sooner do we kind of get ourselves plunged into dealing with clients for real as a new, you know, practicum student, it's like, okay, what theory am I using, and is it working? And you know, no sooner do we start kind of getting used to that, then we start getting confused about, wait a minute, is this the theory I like? What am I doing? Is that within the theory? Or, and it can be very confusing. What am I doing? Um, and then there's that period of time where, okay, I kind of know what I'm doing. I kind of have a sense of this. Um, and you know, it's like kind of I'm a colt on my wobbly knees, but I'm, you know, beginning to trot and run too, and I can get this. And as a supervisor, it's important to understand, how do I give them room and build that confidence, so they can really kind of go and learn and be, you know, become the professionals and become confident. Now, the 3I is the integrated. I mean, that's kind of the aspirational piece where we all want to be, is, you know, not only do we kind of understand our theory that we used really well, but we feel confident, and, you know, we still may have questions occasionally. And that's, you know, if you've got someone who's at that level and you're supervising them, how do we work within that space for them to allow them to continue to grow and have that confidence, but be there to provide, you know, a helping hand when they need it. So I like this model because it really does. I have supervised people from the very first practicum to postdoctorate. So I like it because it really provides, that conceptualization. If you're supervising different people at different levels, how do you do that? And the model does kind of lay out, thoughts and concepts, at each level to consider, to help provide the support and structure as your supervisee is going through all of those things. So as a foundational piece, I just kind of wanted to talk about that. And I will say, I mean, this is just a comment that, no, it's very much a stage development model, and people do go through those things, but people do it in their own way, and it can be very, you know, I may show signs of getting to the next stage, but I may still have some things at the previous stage before I kind of completely get to that stage. Again, that's all part of understanding your supervisee's development and what they may need. And like I said, another model that I included in your booklet is the discrimination model. And that's where you're thinking about, as a teacher, a consultant, counselor, is your very first new supervisees probably going to need a lot of teaching, and a lot of questions about, you know, you seem to be getting stuck, you know, what's going on, how are you feeling about this? But as someone becomes more developed, and more seasoned, it may become more consultative, where it's more, you know, here's what I'm thinking, you know, and I think this will work with my client, you know, what do you think? And it's more, yeah, you know, and here might be another conception. So it's more consultative. So I like that, those two models, because I think they work well together. So I want to talk about models just because, you know, it's a foundational understanding, I think, for clinical supervision, that you be working from a model. And that part of the work as a clinical supervisor is that you figure out what your model is, and work from it, and have, just like you built your theoretical orientation as a clinician, what is the model I'm working from as a clinical supervisor? And that becoming a fairly foundational ethical, piece, that you're thoughtful about that and creating that for yourself. So that's why I wanted to spend a little bit of time on that. The other thing that I wanted to spend a little bit of time on from an ethical, consideration, ethical standpoint, is training. Because more and more, the professions are becoming a bit more specific about what kind of training or considerations you should have, as far as the training you should get as a clinical supervisor. And for some folks who may have been in a profession for a while, that may be a surprise, because early on in the profession, I know early on in my career, it really wasn't something that was hit very hard. I was very fortunate in my doctoral program to have taken a clinical supervision class where I was supervising one of our master's students from our program. So I feel very fortunate that I had that grounding, but at that time, it was not something that was commonly done. Now those kinds of things are being built into graduate programs more, and that those requirements are becoming more reflected in the ethical guidelines that each profession has. So it's something to be aware of. So I've done this alphabetically: counselors, psychologists, and social workers. So bear with me. So with counselors, from their code of ethics, it doesn't specifically lay out in the American Counseling Association Code of Ethics exactly what the training should be, but it does say that counselors should be trained in supervision and pursue continuing education in clinical supervision. So for those of you who are counselors out there, something to be aware of. I also have, for counseling, there are ethical guidelines for clinical supervision. And actually, in some ways, the counseling profession has led in the need for training for clinical supervisors, because there have been ethical guidelines for clinical supervision in counseling for a while. And there's something called an approved clinical supervisor, or an ACS, that you can pursue. And it usually requires either a graduate class in clinical supervision or a 30-hour training in clinical supervision. Once you've done either one of those things, then I believe it's 100 hours of supervised supervision of your clinical supervision practice. So you would need to find a supervisor who would supervise your supervision. So, and then you would be able to get your ACS. Most people in the counseling world are familiar with this, and there's no provision in the ACS that would prevent a psychologist or a social worker from pursuing the ACS and getting that training and being able to have that, that certification. So, and I've given you a link for that. So those of you who are interested can take a look at what that is and what that entails. I've also included Maine. What does Maine require? So in Maine for counselors, it does have a provision. I did write out the whole thing, but there is a link to the rules from the licensing board for counselors at the bottom of the slide. So if you go to the counseling licensing board, it's under rules, not laws, but under the rules, under the code of ethics, under the rules, there is a provision that says that supervisors must be well-trained and experienced in providing supervision. And misconduct, and this is where they start getting detailed, engaging in supervision without adequate training, and failure to maintain regular substantive and ongoing professional development. So for those of you who weren't aware of that, and it's part of what this presentation is hopefully bringing, is a highlight that even the state is outlining the requirements that you have training and that you keep your training up to date. So, so that's for counselors. For psychologists, under supervision competence, it does talk about formal education and training, and then it lays out, it should include, and they get very specific about the different ways that that psychologists should consider getting trained in clinical supervision. And as I've said, it's a newer requirement for psychologists in their graduate training that they have a class in clinical supervision. And I have to admit, one graduate program that I know of is basically set up as an independently. You're to basically read the Bernard and Goodyear book and write a report, and that's the class. So as you can probably tell, I would want it to be a little bit more detailed than that, and actually have some aspect of application so people can learn what it looks like to be a clinical supervisor. So even though some of these requirements are coming through, I think some graduate programs may still be grappling with exactly how to do that and what to make it look like. So in Maine, for psychologists, they actually lay out all the different things. Of course, you need to be licensed in Maine, but it also lays out the ethical principles. Psychologists must be competent to supervise by virtue of training, experience in the supervising practice. And for those of you who don't know this, psychologists practicing under a conditional or temporary license may not serve as a supervisor. So just so you know that. So psychologists have it laid out fairly specifically in the state. I also want to say that in psychology, I think it's 2014, and this may be me going up a slide. The APA guidelines for clinical supervision and health service psychology is actual guidelines, and it's a whole document that talks about all of the considerations for clinical supervision. So for those of you who may have been a psychologist for a while, just be aware that that's a new document that came out that's providing guidelines for people who are supervisors. Also for psychologists in the state of Maine, there is a requirement that for each renewal cycle for your license, that you have to have 3, if you're doing supervision, you have to have 3 CEUs in clinical supervision. And I know that maybe by many of you are taking this workshop today. So, so that's an additional requirement. And that is a requirement that's new. When I first came to the state of Maine in 2000, it was not a requirement. So it is a requirement that's been added over time. Again, recognizing that getting ongoing training in clinical supervision is important because you need to stay up to date. You need to, it is a discrete intervention. Ethically, it's just really important. So for social workers, this is from the NASW. Social workers provide supervision and consultation, have necessary knowledge, skills to supervise or consult appropriately, and only within their basically scope of practice. And I also know social workers do provide training in clinical supervision. And again, there's a lot of books and a lot of guidelines out there, not guidelines, guidance out there for clinical supervision within the social work. I will say that I did not find anything at the state level for social workers that specifically outlined supervision practice. So will say that I'm not a social worker. I've not taught within a social work program. So if there are additional resources out there that I may not know about. So I want to be really, really clear about that. But as I was looking, this is what I found. But I also know that there are many books, many emphases on clinical supervision. So I do want to kind of say that. I want to mention the LADC, the Licensed Alcohol and Drug Counseling requirements, because they do lay out requirements. If you want to go for your LADC, your Licensed Alcohol and Drug Counselor certification, that their requirements are very specific. And it's similar to the approved counselor, the ACS, that you have either a class of clinical supervision, 30 hours of training in it. And there are programs around the state that do provide that training for people who are going for their LADC. So I wanted to kind of mention that, not only from the standpoint of if you're going for your LADC, that that's a requirement, but also for those of you who may want the additional training, there may be ways to get that additional training through some of the programming that may be offered around the state. So a lot of people may go, okay, why did we do that? Talk about all the requirements. And it's really to emphasize that ethically, if you're a clinical supervisor, it's beholden upon you to make sure that you're getting the grounding and getting the training in how to be a clinical supervisor, and that you're keeping that information up to date for yourself. So just kind of wanted to mention that. Also, I just kind of want to also emphasize that under each slide are links to not only the national associations ethical guidelines, but also I tried to provide the links for each of the licensing boards. And those links are not only in the slides, but also in your booklet that I provided at the end of resources. So, so you just have that information for you for later consumption. I was lucky enough to work with, when I was at USM working in the counselor education program, I was lucky enough to work with a woman named Mary Jane Fall, and also get to know Jack Sutton. And they co-authored a workbook for clinical supervision. And I think they did a wonderful job encapsulating a lot of the aspects, practical aspects of clinical supervision. So some of this information is from the workbook that they created. So some of the considerations when you're supervising to keep in mind, and they came up, I think, with a great list. Supervise only in your areas of expertise. So for example, if you are if you have certain theories that you ascribe to, and you have a supervisor who wants you to supervise them in a theory that you're not familiar with, being able to be very clear about that that's not necessarily within your scope of practice, or working with a population that you're not familiar with. So being able to be very clear and transparent about your scope of practice, what you can and what you can't supervise around. And of course, we also know that, if you are wanting to learn about something new, that you get your own supervised practice around any new areas. So supervise only in your areas of expertise. Make sure you're choosing a supervisory model, which is why I kind of talked about that quite a bit. And it's important that you be able to speak to that. I won't kind of hit that anymore. Avoid and manage dual relationships. And from a clinical standpoint, we understand the dual relationship piece that, we don't clinically work with our friends, we don't clinically work with family members or our romantic partners or whatnot. Same thing goes for working with supervisees. And if any of you work in an academic setting, some of those can get a little blurred from the standpoint of, I may be teaching you in a class 1 hour, and then the next hour you're my supervisee because you're doing a practicum and I'm supervising you. So within those situations where you may be wearing more than one hat, or you may be at an agency where you're somebody's boss, where you are giving them feedback about how they're doing in a job, and needing them to follow policies and procedures for the place of business. And then you're also their clinical supervisor. Those are two very different hats to wear. So it's important that you clarify that with your supervisee so they know what hat you're wearing. Because there's a certain vulnerability that a supervisee it's helpful if they bring some of that to their supervision sessions to be able to talk about the things that they're challenged with, the things that they may be struggling with. And if you're wearing your boss hat, that may be harder for them to really share with you the things that they're really needing to work on. So, and because of that, there may be information you're missing as a clinical supervisor to help them not only in their professional development, but also any ethical things that may be going on that you're not aware of because they're not comfortable sharing that. I heard a story where someone actually had two different hats in their office. One, I don't know if it said boss on it, but it said something like that, and their other hat had supervisor on it. And so it was kind of a jokey kind of way to really make it clear that, you know, right now in this moment, I am your supervisor. And here's the safe place for you to be able to do that, but now I'm your boss and we need to talk about some different things. So being able to do the dual relationship thing and being crystal clear and as transparent as you possibly can is not only important for you, but it's important for your supervisee, so they understand where you're coming from and the safety of the room to be able to talk about what they need to talk about as a supervisee. Evaluation. Those of us who have worked in academic settings, evaluation is so much a part of what you're doing and will be built into the academic setting and their classes they're taking. If you're a site supervisor or you're supervising a postdoctorate that's not in kind of a real structured an academic setting, it's still important that you have some form of evaluation and that you present that to your supervisee from the get-go. And I think that, yes, clinical contract. But that starts getting into the contract that you have with your supervisee. And it's informed consent. Just like you do that with your clients, you need to do it with your supervisee. So it's the idea that when your supervisee meets with you for the first time, that you're very clear about expectations, very clear about your availability, very clear about what evaluation is going to look like. If you're not the one who's going to be doing, well, just being very clear about it, and also being very clear about how that works maybe within the agency or within the setting that they're working in, because you may not be the only one giving them evaluation. And that's where, you're the clinical supervisor, but if they're also working at a place where they, as an employee, need to get an evaluation. So again, being really clear about how those are different and how that plays out in your supervision relationship. So that's also where you talk about your model. And some people, well, I actually write up what my contract with my supervisee looks like. I talk a little bit about myself, my experience, what model I'm going to be using, availability, expectations, etc. So that's something that we go over at the very beginning of our supervisory experience. So it's a way to kind of lay out some of the things that are on this list. So evaluation is important. There's lots of different evaluation you can do, and the scope of this presentation isn't necessarily to talk about all of those things, but you could do more of a narrative. You could be more of a rating scale. The Bernard and Goodyear book actually has a toolkit that has examples of evaluations. If you're not working at a place that has the structure that's already provided and you want to think about what you want to do, something like that can be helpful for you to perhaps take a look at and develop your own. Along those lines, documenting your supervision can also be important. And not everyone has this as part of their practice, but I want to talk about documentation from just, I think, good practice and ethical ethical considerations as well. if you're documenting your supervision, if there has been an ethical situation that's come up, you are outlining what it was, how you handled it, who you consulted with, et cetera, et cetera. And if anybody would come back and ask you any questions about it, it's right there in your notes. Plus, it also can be good for a thread of the things that you all are working on with each other, and that can also be helpful as part of your evaluative process. So documenting supervision is something that can be important as well. Being available is so important. I've heard horror stories from people who may have been doing their practicum or their internship or whatnot, and they never could get a hold of their supervisor. Their supervisor was just too busy or kept canceling their appointment for supervision or just was not available. And that's a setup ethically, not only for your supervisee to not have the guidance and support, but also a setup for you as a supervisor to get yourself into trouble. You would never want to be brought in front of a licensing board if you've been unavailable to defend why you weren't available. So being available. I know at our practice at psychology, psychological specialists of Maine, one of the things that we've talked about in our meetings around supervision is how we are available during this time of the pandemic. It's just been so interesting to try to have our regular meetings with supervisees, which of course has been virtually, but also how do you be available for what used to be kind of drop-in supervision of, hey, I got a question, your door's open, I just thought I would ask, whether it's of us or somebody else in the practice. Because of course we don't have that possibility to just kind of stick our head in somebody's office and say, hey, I got a question. So we've talked about different ways to try to make ourselves available, from texting to having a discussion chat room set up for supervisor supervisee. So we've been thinking about how to continue to be available in ways that we normally would be, but it's not perfect. The pandemic certainly has provided a lot of additional challenges as we do things. So I talked about the contract. Financial considerations. Some of you, it may not be an issue. You may work at a setting where it is academic, and you serve as a site for someone doing their internship or their practicum. So there may not be financial considerations. But some of you may be providing supervision for folks who are doing their conditional licensure, and they need the supervision during that time. And there are fees often associated with that. So just being really crystal clear about your fee schedule, and again, having that perhaps in your initial contract, so your supervisee knows what, has an understanding of what that is and what any permutations around that might be. Professional liability coverage. I want to talk about that a little bit from the standpoint of not all liability coverage specifically talks about clinical supervision. So if you have liability coverage, talk to, or whether it's something you can read in it and it's clear, and if it's not, talk to your provider to make sure that clinical supervision is something that's specifically covered in your liability insurance. I'm hoping that as clinical supervision is becoming a more solid part of our practice, that more liability providers are aware of that. Last and not least, but the supervised honestly and with integrity. And the reason I want to kind of hit that a little bit too is because our relationship with our supervisee, just like with our clients, is part and parcel of our work. And just like if we are having a troubling relationship with clients, that's where a lot of complaints can come to licensing boards and so forth. Same thing goes for our relationship with our supervisee. We want to have that relationship be positive, be clear, and that's why having things like a contract at the very beginning can be so important, because it lays out those expectations for how often we meet, what model I'm using as a supervisor, what are the financial considerations if they're part of the picture, how do you get a hold of me, if you want to report me, having something written into that, that if you're not happy with what you're receiving as a supervisee, what recourse do you have? So being able to take care of and foster that relationship can be so important for so many reasons, not only from the standpoint of your supervisee's professional development, but also from the standpoint of any complaints. So that starts kind of getting into some ethical pieces there. Many of you may have experienced or have heard. I certainly have heard many stories of people who said they've had horrible supervisors, and they've learned how not to be a supervisor by some of the supervisors that they've had. So the relationship can be so important, and that you're fostering and taking care of that relationship can be really important from the standpoint of your supervisee's professional development, that they're getting what they need, and that you being able to kind of check in with them pretty regularly. How is this going? What do you need? What's working? What's not working? Which is another thing to kind of talk about with evaluation. It can be very helpful to provide your supervisee with a means to evaluate you. So you have a chance to talk about what's going well, what's not, how you can improve things. So the relationship with your supervisee can be so important, because you're also modeling that for them as well as fostering their professional development. Um, Along those lines, I guess I also want to talk about viewpoint of supervision. And what I mean by that is 20 plus years ago, when I was going through my doctoral program, I feel very fortunate that I did have a program that had a class in clinical supervision, and we were actually able to supervise as part of that. But I know many of my friends that went to different programs didn't have that. Um, and they also had supervisors who basically, they would go in once a week and the supervisor would tell them, here's what you do. Okay, for this client, you need to do this, this, and this. Okay, who's your next client? Okay, for this client, you just do this, this, and this. And, very scripted process under which that they would work with each client. More these days, clinical supervision really is focused more on, what do you need as a professional? So here, what are you learning? It's the more focus on your supervisee, and they're providing the interventions and appropriate support to their clients. So yes, you're monitoring the clients that they have, and that the clients are getting what they need, but you're allowing your supervisee to have independence and decision over what they do with their clients, and you're helping them with that process. So your focus being more on the development of your supervisee and how they're providing services, rather than you dictating kind of what they're doing. So there's that shift, I think, can be important, that your supervisee, and that can be scary for your supervisee. So that's part of the supervision process too, is how do you help your supervisee manage providing those interventions and services to their clients, and them having the answers because they know the answers. Obviously, you're providing the appropriate teaching, the appropriate support, resources for them to have that knowledge to apply, but not necessarily telling them what to do. Now, obviously, there are some situations where you need to tell, maybe an ethical situation where they need to do certain things, or it may be a crisis situation where you become more active in telling what needs to happen. And that can very much be developmentally appropriate as well. And someone who's really new is going to need a lot more structure around that than somebody who may be at the postdoc. So some key dynamics with ethics are some of the things that I guess I wanted to kind of present as some things to consider. I feel like I'm talking really fast.
Is this a good time to take a few questions?
Absolutely.
Okay, I'm going to read what's come up on the chat box. When a professional is licensed but receives supervision from the director of a clinic, what responsibilities exist for the director?
Okay, so if I understand that question correctly, this is somebody who's already licensed, but part of the requirement of being employed at this clinic is to receive supervision from the director of the clinic. That sounds like that's the question.
Like that. Mm-hmm.
So I think anytime someone's taking on a supervisory role, even if somebody's who is licensed, that starts getting to that informed consent piece with that idea of a contract. What exactly are the responsibilities? Because if somebody's licensed and they're independently licensed, what is the supervision around? Is it the need of the clinical director to know what's going on with the clients that are within the practice, or is it truly that's very different than providing clinical supervision in the stance that the clinical director would be, because they've got an official clinical supervisory relationship, then yes, they would be taking on probably more responsibility than I would think maybe they would want, but for providing the supervision to someone who's already licensed. So that's a situation where I would think the clinical director would want to be very clear what the purpose of the supervision is. Is it a clinical supervisory relationship that has a contract, that has expectations, that has evaluation, and that it would be helpful to have that laid out very clearly ahead of time for all parties to understand, and what are the shared responsibilities? Because in most situations, the supervision is being provided to someone who is not licensed yet. I know in some professions, like counseling, for example, many people will receive ongoing supervision to make sure that they're staying on top of things, to make sure that nothing's getting slippery. I mean, many people will continue that as kind of an ongoing resource for themselves. But I think it's so important that you be really clear about what's the responsibility, who has the responsibility. Is this truly a supervisory hierarchical experience where the clinical supervisor is responsible for everything that the licensed person is doing? And that means taking on a certain amount of responsibility. Or is it a consultation experience, which moves it more to a parallel, a side by side, where we're consulting with each other? And that has a much different sense of responsibility to it. So I'm not sure I'm answering the question, but as a clinical director who may be providing clinical supervision, being really clear what that means. Is it truly clinical supervision where I, as a clinical director, am responsible and my license is responsible for the people that I may be doing clinical supervision for? Or is it more of a consultation where I'm checking in with the people who work at the clinic? And that moves it to a much different relationship.
Thank you. One more. What are the ethics of confidentiality in supervision?
It's a great question. And there's a lot of different permutations to this. And in this format, I'll answer it as best I can. But keep asking questions if I don't get to it, if I don't answer it the way that you want me to, or don't get to your question. So with supervision, you have confidentiality. The same rules of confidentiality apply as a supervisor to your supervisee. So what you hear in supervision for the clients that your supervisee is working with, you need to keep that confidence like you were working with those clients directly. So, so I'll keep it at that. However, if an ethical situation comes up where one of your supervisee's clients is threatening to harm themselves, is aware of child abuse, elder abuse, abuse of someone with a disability, if a legal issue has come up, then how do you work within the supervisee-supervisor relationship to resolve those issues confidentially, so your supervisee can do the things that they need to do to resolve those issues? Now, one of the things to write into your contract and be very clear about at the very beginning when you're supervising someone from the standpoint of confidentiality is if you then are doing your own meetings around your supervision of supervision, and many sites provide the supervisors to receive, whether it's monthly or every other week, consultation with the other supervisors at a setting to talk about what's going on with their supervisees, making it really clear from the get-go that that's something as a supervisor that you engage in. So they know that you are doing this supervision of supervision, and they can ask whatever questions that they ask. Best practice is being able to let your supervisee know if you're sharing anything in that supervision of supervision meeting that is of concern to you as a supervisor, that your supervisee know. This is something I'm going to consult around. This is something that I'm going to share and talk about in the supervision of supervision, and I will get back to you and let you know what came of that. So as far as confidentiality, you treat their clients in the same way that you would treat your clients with confidentiality. And if you're doing your own supervision or consultation, that your supervisee be aware of that. So I'm not sure if that gets an answer to that particular question. If not, ask another question that might get to it.
Thank you, Sue. That's all for now.
Okay.
That I'm seeing. Yeah.
Okay. Thank you for the questions. That's great. So resolving ethical dilemmas. There are different models out there for ethical decision making. I've included the one that is actually on the American Counseling Association website. As far as I could find, it's the only national association that actually lays out a decision-making model on their website. Now, having said that, there are many books out there about resolving ethical dilemmas. There are books out there about resolving ethical dilemmas within supervision. So there are a lot of resources out there that provide decision-making models beyond this one. So I just want to make it clear that this is not the only one out there. There's a lot of decision-making models. Again, it's important to have some sort of a decision-making model. So if, God forbid, you ever pulled in front of a licensing board or somebody questioned you about how did you make decisions? How did you resolve this? How, who did you consult with? What did you do, et cetera, that you have some sort of an answer, and that, it's part of your practice. So, so that's something to be thoughtful about. From this model, it's a 7-step model, and I chuckle because a lot of people go, that's a lot of steps. But when you're having an ethical dilemma, sometimes it's nice to have enough structure to really kind of think things through. And if you are consulting with someone around an ethical issue, again, be transparent with your supervisee, who also, by the way, should be being transparent with their clients that they're in supervision. So that's ethically really important, and that's spelled out very specifically for some professions, that a supervisee who's in supervision has that laid out as far as their informed consent. So the one thing that I guess I would like to say about a decision-making model, is the first step is always identifying the problem. And it's interesting because sometimes what you think is an ethical dilemma, once you start really identifying what the problem is, you may realize, okay, this really isn't an ethical dilemma so much as it may be a values dilemma, or it may be a personality conflict dilemma, or it may even be a workplace policy dilemma, and not necessarily an ethics issue. So identifying the problem can be important to really clarify, what is it that I'm dealing with here? And is it an ethics situation? What exactly is this? And for many dilemmas, it's multifaceted. Usually it's not just one thing. So really being able to sit and think about, what is it that I'm dealing with? Why is this a problem? Can be obviously a really important step. And that may even be the step where people are consulting with others to say, I'm really stuck, I'm having a hard time identifying, this is what I've come up with, what do you think? So I'm also a big one that when you're dealing with something and you're stuck, consult. Definitely make sure you're making the people who need to know you're consulting aware of it, and that you are working within the confidentiality scope. So being careful about that. So identify the problem. Once you've identified the problem and it seems to be clear that it is an ethical piece, here's my ethical question, then take your guidelines, your code of ethics, your clinical supervision guidelines, pull them out, take a look at them, see what seems to fit, and use that as kind of a template. The nature and dimension of the problem, that's where that's multifaceted piece, that it can be multifaceted. There may be different parts of it that you need to investigate and take a look at, that may be many ethical particular situations, or it may even be more than that. Are we even going into legal situations? Does this involve other parties that we need to be thinking about? So the nature and dimension of the problem, especially if we're dealing with one of those that's very thorny, can be really helpful. The brainstorming part, the generating the potential courses of action, that's where, well, I could do this, I could do that. Do I need to consult with the National Association Ethics Office? For psychologists, the trust liability insurance has a means for you to be able to consult with someone around ethical legal situations. Do I just need to consult with somebody else in my profession? I mean, who do I need to talk to develop the different courses of actions and kind of do that brainstorming piece? Consequences. Every course of action is going to have a consequence, right? So what are the consequences that I really should be considering as I think about what this option might entail, and this option might entail, and this option might entail. Um, and for a lot of people, since this can get difficult, being able to have some means and process for you to kind of sort through all of the different pieces. I'm a visual person, for example, so me writing things down where I can see it can sometimes be a way that I can kind of try to think about the permutations of different things. Whatever it is that you do to help you think through these things, make sure that you kind of have a process for yourself that helps you do that. And evaluate. Once you kind of come up with the 2, 3, however many things that you think could be viable, is there one that's maybe more viable than the other for various reasons? And then, of course, there's the implementation phase. And it's important to have a process so you can document it. That gets back to the documentation piece. Because if you're having an ethical situation or any kind of a challenge with your supervisee, being able to document what it was, how you sorted it out, who you consulted, being able to document the steps and document what did I decide to do, when did I implement it, how was the outcome? Did that outcome work? Do I need to go back and decide something and think about something else because maybe that didn't work? So being able to document all of that, because again, if anybody comes back and asks you questions and wants to kind of find out why you did what you did, that you're able to go back and say, here is the process that I followed. Here is what I did, and I documented it all. So from an ethical standpoint, having your decision-making model figured out for yourself can be really important too. And I have to say, there is a book out there that's caught my interest, and it is Ethical Decision-Making and Supervision or something like that. And I'm like, oh, I think I'm going to get that book because that sounds interesting. So, so it's definitely something that can develop over time or change over time, but that you have an idea of what it is and have it in your hip pocket so you can use it when you need to, can be really helpful. I included consultation resources because sometimes we have those situations that are just so thorny and so scary, because sometimes we have oh my gosh, am I covering all my bases? Am I really thinking about this as thoroughly as I can? Yes, I've consulted with peers or with the super group or whatever, but have we really covered everything that needs to be covered? And is my thinking about this right? So there are offices for everybody to consult with. I mean, I found one for counselor psychologists and for social workers. And I kind of chuckle at D. Johnson, like for counselors on the American Counseling Association website, there's a phone number and a djohnson@counseling.org. So apparently D. Johnson gets to handle all of this, but I suspect that he or she is simply the contact person. But I just kind of imagine how many emails or phone calls this person gets on a regular basis. The other professions, it's more anonymous who you contact. For psychologists, it's the APA ethics office. You can also, like the trust insurance, like I mentioned, there's an advocate program that you can contact if you're having a particularly thorny issue that you want to hash out. And then for social workers, Office of Ethics and Professional Review. So some of them, it's providing your information and they'll get back to you with an email. For some of them, you can actually choose what kind of question you want to ask and you fill out a form. So, but regardless, each one has a way for you to consult. I'm not sure, but AMCA doesn't also have a way. The American Mental Health Counseling Association, now that I think about it, AMCA may even have another way that you can consult with AMCA if you want to for counselors. So just thought of that right now. So the whole point is that if you're stuck as a supervisor, you don't have to be. And if you're stuck as a supervisor, you should be consulting. You should be looking for resources and being transparent with your supervisee about what that looks like. And also for them to be clear with their clients that they are under supervision. So, so from all of that standpoint, just wanting to kind of be really clear about that. So at this point, I'm keeping an eye on the clock. I'm not even sure if the clock in here is right. It looks like it is. This seems to be a good place to break for 15 minutes before we get into the breakout session. And the rest of our time will be spent with really applying some of this and talking about it. So any final questions about what we've covered so far before we go into break? Okay, so we'll meet up again or start again, or however you say this with virtual at 10:30. I think that's right. Okay, all right. So I will see everyone in 15 minutes. wait a few more minutes. Well, I have 10:30 on my clock, so I'm going to go ahead and get started. It's so funny in this format. I mean, normally if I were doing this in a room, I would see that most of the audience had come back. But in this format, we'll hope that everybody is back on. So with the breakout sessions, because of the format that we have, you're going to have to bear with me because I'm not perfect with this, and I'm not sure that I thought through all of it 100% as well as I could have. So bear with me. But essentially, we're going to have you break out into discussion groups, and Julie is going to be the one who helps me with that, thankfully. And you're going to be randomly assigned to groups. And what's going to happen is I'm actually going to read out the ethical scenarios because we couldn't quite figure out how to get each group an ethical scenario in this format. So I'm going to read them out. Take notes on each one just so you kind of have a flavor for what it is the scenario is asking for. And I'm encouraging people when you get into your group, if there's an ethical scenario or a dilemma that somebody has that they'd rather address, then that's perfectly fine. But in your small group, designate someone who is going to be the reporter out of, what did you decide the dilemma was, and what was the course of action you decided would be helpful. So, and we're going to give you about 20 minutes. I'm going to give you 20 minutes for you to be able to talk about all of these, all of the permutations of the dilemma. And then we'll have you come back and report out, and we'll talk about, there's going to be some duplication. Yeah, right. Duplication, obviously. So it'll be interesting to hear the different facets. Because one of the things that's also true about ethical dilemmas or those thorny dilemmas is there can be several ways to resolve it in a healthy, helpful way that may be slightly different from the way somebody else resolves it. So sometimes there isn't kind of one right answer. Clearly, there are some of the I need to report, and that's clear cut because I'm a mandated reporter. But some, there are more nuances, and some of the ways that we handle them can be nuanced, and they still can be helpful and still resolve the situation. So if we have groups that are dealing with more than one group dealing with the same ethical scenario or dilemma, that's okay. It'll be interesting to hear the different thinking that's going on, and that's okay. I think that will be helpful for us to hear and learn from. So, so hopefully this works out. So I'm going to go ahead and read out the ethical scenarios. And I will also, it's in your handout for those of you who either printed out your slideshow or printed out your booklet. The decision-making model from the American Counseling Association is in either one of those things. So for you to be thinking about following those steps, and it can be loosely for the purpose of this, so you're at least thinking about how would I utilize a decision-making model to come up with a course of action. So, so we'll see how this goes. Let me go ahead and read out the scenarios. So with scenario one, you're one of 2 licensed mental health providers at a site that hosts interns. 2 interns were accepted for the placement. You have a prior relationship with one of the interns, so your licensed colleague has been supervising that person while you supervise the other person. However, your colleague has unexpectedly needed to be out of work for an extended amount of time. unfortunately, maybe they got COVID or something. So, but what are the considerations for the ongoing supervision of the intern that you have a relationship with, but also still needs to be supervised? And we live in a very rural state? So what would be considerations for the ongoing supervision of that person if you were in a very small community? So that's scenario number one. And as I've asked at the bottom, have you experienced or heard of something similar? So if you would choose to talk about something that you want to bring to your group, that's fine. But I will say confidentiality, be aware of confidentiality. So if you all are talking about a real situation, that you're masking it in enough way that we're not breaking anybody's confidentiality. So just be aware of that. Scenario two, at a local restaurant, you overhear a colleague at another table telling a story that you recognize from work. As you hear the bits and pieces of the conversation, you realize this colleague's sharing information about a clinical case from a supervisor with whom they work. What are the considerations for the situation? Would it make a difference if the colleague's table mate's also a mental health professional, whether you would know that or not if you were sitting at the table next to you? Again, we live in a small community, and sometimes people do share things within hearing distance. Have you had a similar situation or similar scenario that maybe you want to talk about? Scenario number three, you are working with a supervisee who consults with you regarding reporting child abuse to DHHS. It's a clear case that it does need to be reported, but your supervisee is hesitating because of concerns for backlash to the client. You deem reporting is necessary for the immediate safety of the client, of the child concerned, but your trainee continues to refuse or to find excuses not to follow through. What are considerations in this situation? And have you had a similar situation or one that you perhaps want to share with your group? Yeah, be careful of confidentiality. Scenario four, you have been working with an intern who is failing to understand the nuances of complex cases in ways that would be expected of a supervisee at this level of training. The trainee is scheduled to finish soon. What are considerations in this case and possible options? Yeah, have you dealt with or heard of a similar situation? And the last one that I have is you have been supervising an advanced trainee with whom you have a good working alliance and who you perceive as a talented clinician. This supervisee has been assigned a client who presents with a diagnosis with which you are not experienced and are not familiar. What are considerations in this situation? And again, if you have a scenario that's similar that you would want to share, that's certainly an option. I went through those kind of fast. Hopefully you all took enough notes. Do you want me to revisit them? Okay, somebody's saying yes. So let's go ahead, scenario number.